So here's a before and after I wanted to go over with you in a little bit more detail than I normally do. Endoscopic brow lift is one of my most favorite procedures to perform. In this particular case, this patient presented to me with complaints about having excess skin in her upper eyelids, also having some brow descent with some under eye aging. This is her after photo taken almost a year after the procedure, where she had an endoscopic brow lift, upper lid blepharoplasty, and a lower eyelid blepharoplasty with fat repositioning and a chemical peel. The endoscopic brow lift is a powerful procedure in the right patient. In her particular case, it was a great procedure because we compared her current state to what she looked like when she was younger, and her brow was much higher, had a nice shape to it, and the endoscopic brow lift's goal was to help rejuvenate and also kind of bring back that brow to where it was when she was younger. The way I do my brow lift incisions for the endoscopic portion laterally is a small incision about 3 centimeters, right about where my mouse button is, and that gives me access to the temporal aspect of the brow. 3 smaller incisions are made, 2 perimedians, 1 central. This one, the perimedial one on the right side is here, the central is right here. They're behind the hairline. And that gives me access to using an endoscope, which I'll show you in this video here, is essentially the view that I have when I'm operating. And you can basically see the tissues from underneath through these minimal incisions. That allows for us to do our work and to then carefully elevate the eyebrow and then fixate it. In my particular case, I like to fixate with endotine implants, which dissolve in about a year. And in doing so, I can then subsequently approach the upper lid excess skin, remove it through a standard upper lid blepharoplasty incision. The sutures come out in a week. Everything about the endoscopic brow lift is hidden, so the staples that we use come out in a week as well. And in doing so, the lower eyelid is the last thing that we do. And I want to kind of show you her primary gaze view. You can see a nice improvement before and after. Excess skin removed, brows elevated to a desired place, lower lid blepharoplasty done at the same time. Very clean result. One thing to note is I did a chemical peel in her particular case because she was slightly hyperpigmented and I didn't feel comfortable doing a CO2 laser. Granted, if she were lighter skinned, I would consider doing a CO2 laser to help reduce the chance of a postoperative hyperpigmentation. Either way, good result. You can notice that her before and after, her forehead is a lot more improved. There's less wrinkles. This is the effect of Botox. I do recommend my patients to undergo Botox regularly as a maintenance if they feel like they want to do that. It'll help prolong the longevity, the results of the Botox, the brow lift. So this is a good before and after that I want to share with you. I hope you enjoy it, get a little bit more inside view of how I like to approach my patients when it comes to preoperative assessment. Thank you.